Good evening, ladies and gentlemen. I believe we are on Algonquin territory, and I'd like to take this opportunity to recognize that and say thank you. Now, I am a grandma, and the grandmas in this audience will understand, but that's my grandson at about 3 or 4 hours old. Now, I first became interested in the social determinants in the late 80s and early 90s when I was in government. But I became interested in this topic, how brains are built, more recently after attending sessions at Banff put on by the Norleen Palix Foundation and Alberta Family Wellness. We listened to hours of lectures on how the root causes of adult disease begin in childhood and in the prenatal environment. These advances in developmental biology are building a very persuasive case for a new way of thinking about health promotion and disease prevention. Until now, adult conditions such as coronary artery disease and cancer have been regarded largely as products of adult behavior and lifestyles. But new evidence links adult chronic disease to processes and experiences such as prolonged toxic stress occurring early in life. I know that many of you in this audience and online, I'm sure, are familiar with this work, but some of you may not be. And it's my hope that this will spark your interest and encourage you to look further into the research. In my opinion, this information is so socially, politically, and medically profound that I believe it is incumbent on governments to take comprehensive and sustained action. It is also important that the science is shared by everyone who has access to it. And you do not have to be an expert or a specialist. I certainly am not. You just need to share it, get the information out, so that communities can then use it. The Adverse Childhood Experiences study of 2 decades ago revealed a troubling but irrefutable phenomenon, that the more traumatic experiences respondents have as children, such as physical and emotional abuse and neglect, the more likely they were to develop health problems in later life, such as cancer and heart disease. There was also a troubling correlation between adverse experiences, or ACEs as I will call them, and the prevalence of drug and alcohol abuse, unprotected sex, and poor diet. The results of this study brought to light the huge price our children are paying for growing up in unsafe environments. And now we also learn that the interactions between genes and the environment shape human development. Despite the misconception that genes are set in stone, research shows that early experiences can impact gene expression. Experience leaves a chemical signature on genes, epigenetic modifications, if you like, that can determine whether and how genes are turned on and off, how genes are expressed. These modifications typically occur in the cells that comprise organs such as the brain, and they influence how the brain develops and functions. Therefore, early interactions and experiences that children have play a crucial role in the development of brain architecture, and negative experiences can build weak brain architecture and impact physical and mental well-being for a lifetime. The shocking possibility that negative epigenetic changes in gene expression occurring not only in the child who experiences the adversity, but being transmitted to the next generation is why I say this research is so profound. We need to understand it. We need to understand early brain and biological development and teach it in our schools and universities We need to use it to inform communities, police forces, judiciary, health professionals, and all levels of policymakers so that this knowledge can be put into action. If we work to reduce ACEs and create safe environments for our children, it is an investment in society. It will help to improve the health of our citizens, productivity of our society, reduce crime and other social problems, and enhance the quality of life for children, adults, and families. It is important for us to understand, then, how brains are built and how they are developed so that we make good decisions in our daily lives, in healthcare, and in our schools and communities. Brains aren't just born, they are also built. The basic architecture of the brain is constructed through an ongoing process that begins from birth and begins before birth and continues into adulthood, and some say as long as 30 years old. Brain architecture is comprised of billions of connections between individual neurons across different areas of the brain. The early years are the most active period for establishing those neural connections. Nurturing experiences with adults are critical during this period to build sturdy brain architecture as strong foundation for later development. Brains are built over time, from the bottom up. Simpler circuits are built early in life and lay the foundation for more complex circuits that allow for the development of executive function. Executive function is integrated cognitive, social, and emotional skills such as paying attention, planning ahead, dealing with conflict, following rules, controlling emotions, and ability to prioritize and avoid pileups. So, if the early foundational brain architecture is not strong, it will impact cognitive, social, and emotional skills. Abuse and neglect will result in more weak brain architecture, but risk factors can be offset by the presence of one dependable and caring adult. And although parental roles are important, it doesn't have to be a parent. More likely than not, that caring independent adult is a teacher or some other caregiver. The interactions of genes and experience shape the developing brain. An important part of this developmental process is called serve and return. The serve and return interaction between children and the caregiver. The baby babbles, and the caregiver responds. And this picture, it's my grandson and his great-grandmother, who was 102 in that picture. Yes, she's still doing pretty good. A child asks a question or expresses an emotion, and the caregiver responds. Serve and return interactions between caregivers and the child are critical in reinforcing circuits responsible for cognitive, social, and emotional skills, and which later lead to the development of more complex skills. But simple cuddling is not enough. And that little guy was pretty cuddly. So I was speaking to my son, actually, who's a philosophy professor now, about serve and return. And when my children were growing up, I had a theory that if I told them something once or twice, it went in one ear and out the other. But if I told it to them 6 or 7 times or 8 times, something stuck. And it would often come back, maybe 3 or 4 months later. So I said to my son, Paul, on the serve and return, we did that, didn't we, when you were really young? And he looked at me and he said, Mom, what I remember is you served and you served and you served and you served. So how is brain development negatively affected? One way is through toxic stress. The stress system is an adaptive system that helps us deal with threats. It is calibrated in early childhood in response to stressors in the environment. The body responds to stress by releasing stress hormones for fight or flight, but if these hormones are elevated too much for too long, they can disrupt the development of brain architecture. But not all stress is bad. There are 3 kinds of stress: positive, tolerable, and toxic. Positive stress is an important part of healthy development. Dealing with frustration, getting an immunization, for example, are all part of development and prepares the mind and the body to cope with stressful situations later in life. Tolerable stress does not have to be harmful if there is a caregiver to buffer the stress. For example, an illness or death in the family can elevate stress hormones. But if a caring adult helps soothe the stress response, teaches coping skills, and helps the child regulate the level of stress, the stress should not be harmful. Without this support, the stress could become toxic. What is toxic stress? It is intense, repeated, and prolonged activation of the stress response systems. And there are no caring adults around to buffer the stress response, or the adults are not in a position to buffer the stress, perhaps due to depression or the illness of addiction. So the stress hormones stay elevated for a significant period and can impair the development of neural connections, especially in the areas of the brain dedicated to higher order skills. Toxic stress can disrupt brain architecture and increase lifelong health risks. Adverse childhood experiences resulting in toxic stress are a major pathway to mental illness, substance abuse, and disease. They are common amongst us: poverty, colonialization, racism, substance use in the family, divorce, mental illness, battered parent, criminal behavior, psychological abuse, physical and or sexual abuse, emotional and or physical neglect, and so on. ACEs are progressive and pile up over time. They also occur in groups, and they are rarely isolated. Many of us have experienced at least one ACE, maybe 2, and that's not necessarily a problem. But the more ACEs, the greater likelihood of health and social problems. The absence of ACEs, and there is almost no possibility of problems. As I said earlier, ACEs can influence gene expression in the child experiencing the adversity, but also these epigenetic changes can influence how the next generation's genes are expressed. So prevention in one generation is prevention in the next. Positive influences can also have a positive influence on gene expression in future generations. What is the old saying? An ounce of prevention is worth a pound of cure. Well, that goes for brain development as well. Brain architecture is difficult to change as one gets older. Not impossible, because children are resilient, but difficult. So early intervention and early experiences and environments are critical. And if society gives this the time and attention it demands, there will be huge paybacks for society, such as higher education levels, increased health, lower health costs, higher incomes, and more tax revenues. Many of you will be familiar with the Children's Resilience Initiative in Walla, Washington, and the amazing positive results the community experienced by moving to a trauma-informed community. The Walla Initiative provides us with the beginnings of a blueprint for creating self-healing communities through trauma-informed schools and communities. So since beginning to implement trauma-informed practices in 1999, Walla has seen a 33% decrease in domestic violence, a 59% decrease in youth suicide attempts, and a 62% decrease in high school dropouts. The community deliberately tried to put science into action, and these were some of their strategies. Physicians began talking to parents about ACEs. Material was put in bags parents took home at birthing classes and when they took home their new baby. Information was disseminated wherever it made sense to do so. Head Start staff were trained. Police officers were engaged and began to focus on community relations. They moved from punishment mode to a reward system when a child did something right. The judiciary was informed and judges started to show parents going through a divorce that if they didn't get along with their partner during divorce, that their child was at risk. When a child came to school and was getting into trouble, instead of punishing the child, they tried to find out what happened to him the night before, and more often than not, the child was dealing with a very difficult family situation and was actually in need of protection. So the question they asked was not, "What's wrong with you?" but "What has happened to you?" So what we have learned from Walla helps to inform our strategies for creating self-healing communities that are working to reduce ACEs and create safe environments for children's early brain and biological development. We know that adult disease begins with reducing toxic stress in early childhood, and adult disease prevention, rather, begins with reducing toxic stress in early childhood and prenatally. We know that when children have a solid foundation for brain development, they are far more likely to go on to live healthy, productive lives free from physical and mental health problems, including addiction. Excuse me. We know that healthy adults are better equipped to nurture the next generation of children, and that informed communities that work to reduce ACEs and build safe environments see amazing positive results. We also know our efforts to support families now will yield benefits for generations to come. So why aren't we doing more? I mean, we've only been talking about the social determinants for some 40 years. I think governments have a duty to act. The federal government, in collaboration with the provinces and territories, should implement a comprehensive early child development system with supports for families, including but not limited to supports during pregnancy, early childhood, learning opportunities, high-quality, universal, accessible, and developmentally appropriate childcare, including for Indigenous children living on and off reserve. But we shouldn't depend on government to heal everyone who experiences adversities. So families and communities also need to understand early development and use their own ingenuity and resources to mitigate adversities and to heal those who suffer from toxic stress or its results. So as I mentioned in the beginning, I hope you are motivated to look into this further and share information with your community and to build those critical collaborations. Thank you.